But let's talk about venous insufficiency, because everything we've discussed so far can actually cause venous insufficiency. Is that right?
That's correct. That's correct. So blood clots themselves can cause venous insufficiency. And a patient that has a blood clot develops what's actually called post-thrombotic syndrome. It's a fancy way of just saying the blood clot destroyed the valves.
Okay.
And now you have high blood pressure in your veins, which is venous insufficiency. Other reasons that we alluded to earlier in the show: genetic predisposition, standing long periods of time, pregnancy, and the risks, go on and on. And unfortunately, this is kind of the underlying medical issue when we talk about patients with varicose veins or even the spider veins.
You mentioned some of those risk factors. Let's show our viewers. We have a couple of pages of them. So number one on that list would be blood clots. Correct. Which you talked about, varicose veins.
Varicose veins. Most commonly, it's a sign that there may be something more underlying. Obesity, absolutely. Obesity, that increased intra-abdominal pressure puts more pressure on those veins, making it harder for the veins to return the blood up. Pregnancy and smoking, absolutely. Smoking is a risk factor for all cardiovascular diseases.
Cancer as well?
Cancer as well. You actually are more prone to forming blood clots, DVTs, with cancer. Muscle weakness. Unfortunately, with patients with muscle weakness, they're not as mobile, they're not as ambulatory as we would like. They can't get around as much, so that kind of just laying around causes them to have blood clots. Swelling of superficial veins. Family history is a very strong risk factor, and sitting or standing for long periods of time.